Hi, my name's Pip and I work at Sydney Advanced Physiotherapy, and today I'm going to give you 5 tips for how to get rid of the mummy tummy. So if you've had a baby, you might have noticed that no matter what you do, no matter how much weight you lose, no matter how many sit-ups you do, you can't get rid of that little bulging belly. Now we call that a pressure belly, but it's commonly called a mummy tummy. Now there are 5 things that you can do to get rid of your mummy tummy. Number 1 is to have your alignment checked. So when your body has twists in it, it's impossible for the rest of your body not to notice that. And it's really common to have twists after having a baby because you're doing a lot of one-sided things like carrying the baby for long periods, usually on one hip, and you're doing a lot of breastfeeding. And when people breastfeed, or even people who are bottle feeding with poor posture, what they're doing is they're hunching forward over the baby, and they usually get very tight up the top. A twist in your body will often mean that the muscles can't work properly. A muscle is connected from point A to point B, and when it contracts, it should do this. But if one end is twisted, then the muscle can't work properly anymore. Now, what this does is it means your abdominals can't function properly, and that can impact not only how they look, but how you feel. And you might have other symptoms such as back pain or incontinence if you have some twists in your body. Number 2, make sure your core activates properly. When you are pregnant, your belly has to stretch to accommodate the baby. Now your six-pack can only stretch so far, and so at a certain point it divides and you get a separation. After you deliver the baby, you will commonly still have a separation. Now you might be able to fit 1 finger width into it, you might be able to fit 5 fingers, it might be even wider. Now it's really very important that we address the separation. And addressing the separation means you need to learn to turn your core on properly. So often people will over-brace through their stomach because they want to feel their stomach muscles turn on and they think that's doing their core work. Or they'll just do loads and loads of sit-ups and planks because they think that's doing core work. It's not. Your core muscles, when you engage them, it's very, very subtle, and it's very important to do it properly, because what will happen is there's a divide down the middle of your six-pack and it's called your linea alba. Now, the easiest way to think of it is a little bit like glad wrap. When you have the separation, that glad wrap is kind of nice and floppy, and what we need for that to happen, for that gap to close, is for that linea alba to be pulled tight. So it should feel a little bit like when you get a piece of material and you pull it tight. So to do that, you actually need to properly engage your core muscles. So how do we do this? We do an ultrasound and we actually look at your stomach muscles on the right side and on the left side and make sure you're engaging them properly. When you can engage them properly, that gap will narrow and close and the linea alba in the middle will firm up. If it doesn't firm up, then that can impact continence, back pain, and upper body function going on. Number 3 is learn to breathe properly. Now I know this sounds crazy because you breathe all the time without even thinking about it, but you take 20,000 plus breaths per day. Now if you did 20,000 bicep curls, your arm would be dead tomorrow. If you breathe with your neck and shoulder muscles all the time, your neck and shoulders will always feel tight and achy, and you always feel like you have a knot up here, even if you have regular massages or stretch your neck every day. Now, it's really important that you learn to breathe properly using your diaphragm and using some of the muscles around your lower rib cage. The other thing that can happen is if you're breathing more with your neck and shoulder muscles is you will feel not as fit when you go back to exercise, and it's because you're not getting as much oxygen into your lungs. So your diaphragm is really very important, and it sits underneath your rib cage. When you take a breath in, your diaphragm pushes down to allow more air to be sucked into your lungs. So as it pushes down, there's a lot of change in pressure in your abdomen. Now that pressure has to go somewhere. If your pelvic floor doesn't have enough give to let go a little bit when you take a breath in, that pressure just comes pushing out your stomach and you'll see that little bubble belly. Now because you breathe all the time, you will have a little bubble belly there the whole time. So when you breathe, your diaphragm should descend and your pelvic floor should relax a little bit. When you take a breath out, your diaphragm should come back up and your pelvic floor should contract a little bit. So just try and see if you can coordinate that. See if you can breathe in and relax your pelvic floor and breathe out and contract your pelvic floor. So number 4 is to learn to stand properly and learn to sit properly. So in other words, control your posture. It is very important that you control your posture. I know physios go on and on and on about posture, and patients often go, oh, here we go again, but it is extremely important, and I'll show you why. So a classic mum posture is this. Now, it often happens because you're carrying a baby. Now, babies can weigh quite a lot, so it is extremely difficult to hold yourself up into the right position when you do that. So often what happens is people throw their bodies backwards and push their hips forward. And then that's fine while you're carrying the baby, but the trouble is a lot of mums continue that after they've put the baby down, and that posture slowly adds a little crunch down in the upper body, and you can see straight away my belly starts to push out more. Now, your pelvic floor runs from hip to hip, so if you push your hips forward like that, you will disturb the function of your pelvic floor. The other thing you do is you straight away pop your belly out. If you hunch forward like this or throw your body backwards, then you're decreasing the space here. So as soon as you do that, that pressure's got to come somewhere and it comes out your stomach. So if you want to look a few kilos lighter and you want that belly to go away, then just try and stand with your chest right over the top of your pubic bones and relax your glutes. You don't need to be squeezing around your coccyx when you're standing up. So number 5, lucky last one, is strength and endurance. So this is where physio-led Pilates classes come in. It is really important that once you've got your alignment right, you learn to move properly. Once you've learned to turn your core on properly, that you strengthen that up so that linea alba solidifies and gets really nice and thick and strong. It's really important that you learn to breathe while you move. It's really important that you learn to control your posture while you move. And this is one of the things we teach you in Pilates. So learning to strengthen properly and learning to build up your endurance in a guided way with a physio there who understands how your body works is really very important. So hopefully if you're a new mum, this video has helped you understand a little bit more about what's going on with your stomach muscles and what you can do to get them looking a little bit better and to get you feeling a little bit better about your stomach. So if you need any help with any postnatal issues, or you would like to ask a question about this video, you can drop us a comment below. You can email us at admin@sydneyadvancedphysio.com.au, or you can call us on 9416 4410.